It's exactly 2 months since the state's COVID crisis began, and today New South Wales suffered its worst day so far of the outbreak. Gladys Berejiklian says the case numbers are disturbingly high. It's also the deadliest day. 8 people with COVID have lost their lives, although authorities say one of them, a 15-year-old boy, died from another medical condition. Another 478 people now have the virus. The Premier says unless everyone strictly sticks to the health orders, New South Wales will continue to live in fear. State political reporter Ashley Raper begins our coverage.
Precious cargo from Poland has arrived. Extra Pfizer is now headed to help Sydney's west and southwest as the state's crisis deepens.
Our community transmission numbers are disturbingly high. We had 478 cases of community transmission.
Of the cases, less than a third can be linked. 61 were infectious in the community, but it's unknown whether a further 290 cases were isolating. 4 prisoners have tested positive at Silverwater Jail. There has also been an outbreak at St George Hospital with 3 patients on the oncology ward and 2 staff members being infected. And the virus is continuing to spread within Nepean Hospital. There are now 30 cases from separate outbreaks in the mental health facility and across other wards.
I just want to confirm that Nepean Hospital, including emergency department, remains open and all precautions have been put in place.
The state has recorded its highest number of COVID deaths in a single day. 15-year-old Osama Sabah had the virus but succumbed to pneumococcal meningitis. He died at Sydney Children's Hospital. A man in his 40s with underlying health issues died at Liverpool Hospital, along with a man in his 70s who is now the 8th death from the outbreak within the hospital. Another resident from an aged care facility in Summer Hill has died in RPA Hospital. 3 men in their 80s have also died, and a woman in her 70s.
The death of anyone is tragic, and it stresses the gravity of the situation.
And as the situation escalates, Dr Chand has this sobering outlook.
I do not see vaccination as a silver bullet.
The Premier too concedes that even having 80% of the adult population vaccinated won't solve the current problem.
If you have 500 cases a day at 80%, that is still dangerous just to say let it rip. You can't let it rip.
So now the message is the state can't vaccinate its way out of this. Vaccination rates going up has to coincide with cases coming down. But even then, New South Wales will be a long way from returning to normal.
So long as Delta has presence in the world, even if we had 0 cases and we were at 80% double dose, you would still have to respect some rules.
The rules, it seems, are the only things we can count on. Ashley Raper, ABC News, Sydney.
The outbreak in the state's west continues to grow. There are now nearly 100 cases of COVID in the region. The vast majority are in Dubbo. And that's where Molly Gorman is reporting for us tonight. Molly, children are bearing the brunt of this outbreak.
Juanita, another Dubbo school has been hit by COVID-19. That brings to 8 the number of schools in the city to have students or staff test positive. That most of the students at the Meehan School are Aboriginal and come from disadvantaged backgrounds. Elsewhere in the region, the ABC understands a second case has been detected at Bourke. Even though large distances separate these communities, they're finding themselves connected in unexpected ways. Walgett's plight has struck a chord with the community, hundreds of kilometres away in Coffs Harbour, where donations are being packed for those in need.
I just want our mob to stay safe and have enough resources to get them by.
There were 36 new cases of COVID-19 to 8 p.m. last night, almost all of them in Dubbo. Of the 99 active cases in the Western District, 40% are children between 10 and 19.
This is a really serious warning for parents and kids running around everywhere at the moment. Please stay at home.
There were no new cases in Walgett, but in Bourke, a local resident is being treated at the town's small hospital.
It's probably one of our biggest fears is that it would reach our small community, but sadly now it has,
There are also 2 cases in Mudgee. Elsewhere, numbers are beginning to steady.
Hunter New England has stabilised, even though with 16 cases, they were all either close contact or in isolation.
Australian Defence Force personnel are set to begin arriving in Dubbo from tomorrow to help local health officials whose resources are stretched. While the lockdown here is likely to continue for some time, there is hope for regions that are still COVID-free. The Deputy Premier addressed the lockdown in a hookup with regional media.
When you have no cases and there is no detection through surveillance of either contact traces or movement of people or sewage surveillance, we'd be more than happy, as I said earlier, go back to a very localised LGA approach.
For now, the statewide lockdown continues. Molly Gorman, ABC News, Dubbo.
Police hope that Operation Stay at Home will be the circuit breaker needed to get people to comply with the health orders. Hundreds of extra Defence Force personnel have been called in to help. Kathleen Calderwood is live for us in Auburn in Sydney's West. Kathleen, where are police focusing their efforts?
Juanita, police say this operation is about protecting the regions as well as Sydney. They've set up checkpoints to ensure anyone trying to leave the Greater Sydney area has a lawful reason to do so. And in Sydney, the police and Defence Force are promising a very visible presence to enforce compliance, especially in the city's hotspots. Winding their way through Western Sydney, police are out and telling people to go home.
You move on.
From midnight, the New South Wales Police Force ramped up their efforts.
You can expect to see high visibility policing right across the state. Yes, there will be a focus on those LGAs of concern.
We really need people in those communities just to stay home. Don't leave your house. Don't cut corners.
The focus will be about compliance and making sure we lock down those areas.
In Blacktown, locals say the extra police presence is desperately needed.
I walk every morning and the people no mask, they're walking and no one asking why you didn't have masks.
If it is a lockdown, of course, police have to come outside and check out the things.
We have to do something desperately to ensure that we minimise the spread of the virus, and that means a bigger police ADF presence.
The ADF have been helping out at the Olympic Park vaccination hubs, but with no walk-in vaccine clinics at Blacktown, the Mayor would like to see the Army helping his residents get the jab.
I would hope that the Premier would ask the ADF to mobilise their medical resources ASAP for Blacktown City.
Despite the assurances that police go where the virus goes, there wasn't an obvious difference in the number of officers on the ground today. But there were 500 infringements issued overnight, more than 100 to people who weren't wearing a mask. Police also set up roadblocks at the edges of the Greater Sydney lockdown area. Not quite a ring of steel, but it might be the closest we get to it. Kathleen Calderwood, ABC News, Sydney.